Good afternoon, everyone. We're going to give it just a minute for folks to load into the Zoom call, and then we will get started. Okay. Good afternoon, everyone. Welcome. Thank you all so much for being here for our November Arizona Community Grand Rounds, addressing diabetes in Arizona from plan to action. This is, of course, very timely as we enter the first day of National Diabetes Month. It's November now. My name is Jessica Rigler. I'm from Blue Cross Blue Shield of Arizona, and I'll be facilitating today's session. I'm really excited to dive in and hear from our fantastic experts. First, I'd like to extend a thank you to our partner, the NARBA Institute. They are so instrumental in making Arizona Community Grand Rounds possible. And then, of course, I'd love to thank Mary Jo Gregory, Dr. Mark Carroll, Carla Berg, and Jennifer Pierce for making all of these events happen for us as well. Please make sure you stay to the end of today's session. At the conclusion, we'll share information about how you can obtain your CEUs for today. Now it's my pleasure to introduce our speaker panel. I'll give you a brief summary of their very impressive bios, keeping it short so you can hear from them. First, we're going to hear from Dr. Cara Christ. Dr. Christ is the Chief Medical Officer for Blue Cross Blue Shield of Arizona. Prior to joining AZ Blue, Dr. Christ led the Arizona Department of Health Services as the longest serving director, also having served as the Chief Medical Officer, Licensing Director, and Deputy Director of Public Health since she joined the department in 2008. Here at AZ Blue, Dr. Christ oversees the Clinical Excellence Division, which represents clinical and non-clinical teams aiming to make healthcare sustainable for our marketplace and enhance quality of care. Dr. Christ's teams implement programs and initiatives that fall into several focus areas, including affordability, operational excellence, behavioral health, and value-based care. Dr. Christ is an infectious disease epidemiologist. She earned a Bachelor and Master of Science in Microbiology from Arizona State University and her Doctor of Medicine from the University of Arizona College of Medicine in Tucson. Dr. Christ has been recognized for her leadership and impact on the state of Arizona as an honoree in the 2022 48 Most Intriguing Women in Arizona, Arizona Business Magazine's 2020 Most Influential Women in Arizona Business, and Business Magazine's 2020 Women of Achievement Award. Following Dr. Christ, we'll hear from Martin Tull, who I'm thrilled to welcome today. Martin is a strategist and systems thinker, advising organizations and communities on collaborative solutions to complex problems. Focusing on the vital intersection between impact strategies, business objectives, and market forces, Martin advises partners on how to imagine, fund, pilot, and scale innovative impact projects and campaigns. He currently serves as Senior Deputy Director of the American College of Lifestyle Medicine. Previously, Martin served in many senior leadership positions in the field of environmental sustainability and the outdoor recreation industry, including serving as the founding executive director of the Green Sports Alliance, leading the organization from a handful of founding teams into an international coalition of hundreds of professional and collegiate sports teams integrating sustainable practices throughout the sports industry today. Martin has designed and facilitated sustainability workshops worldwide, been an invited speaker at numerous national and international events, and it's got many public recognitions and awards, including Good Magazine's 100, Pivotal Leader, Portland Business Journal 40 Under 40 Award, Better Bricks Emerging Leader Award, and the Sustainable Business Oregon's 15 People to Watch. We're so grateful to Martin for stepping out of this week's American College of Lifestyle Medicine's annual conference for an hour so he can join us here today. So now I'll turn the floor over to these talented individuals to give some brief remarks. Please, as a reminder, feel free to use the Q&A function in your Zoom to send questions our way. After each of our presenters provides their initial comments, we'll dive into all the discussion and the questions that you have. So Dr. Christ, I'll pass it over to you first to share an overview of the Arizona Blue Diabetes Action Plan and progress of key initiatives.
All right. Thank you, Jessica. And thank you, everybody, for joining us today. I'm going to give a brief overview on what we're doing at Blue Cross Blue Shield of Arizona to combat diabetes in Arizona. So next slide. Just a little bit of background about Blue Cross Blue Shield of Arizona. We are one of 34 independent, locally operated Blue Cross Blue Shield companies across the nation. We are a nonprofit health plan, and we have been in Arizona and serving the Arizona community for more than 80 years. We have more than 2 million members, so roughly about a third of the state's population, and we are in all lines of business. So we serve our Medicaid members, our Medicare, we have the federal employee program, we have commercial groups, self-funded clients, and we operate on the Affordable Healthcare Exchange. So we touch all populations, all demographics, and we are throughout the entire state. But one of the exciting reasons why I chose to join Blue Cross Blue Shield of Arizona was the impact that they have on the community, because they go above and beyond to serve our entire Arizona community and not just the members. And one of the ways that we do that is through our Blue Cross Blue Shield of Arizona Foundation for Community and Health Advancement. And this is a 501c3. It's a private non-operating foundation that really makes bold commitments in the areas of chronic conditions, mental health, substance use disorder, and health equity. And they give grants. We arrange for resources and volunteers to go out in the community where we can make an impact in the lives of Arizonans, specifically through these programs and applied research. So very proud to be here today, but now let's go through to the next slide, and we'll talk a little bit about diabetes in Arizona. And this is going to be the statewide data. This isn't just the data from Blue Cross Blue Shield of Arizona. You can find more statewide data through the Arizona Department of Health Services. But as you can see, in Arizona, 1 in 3 Arizonans have prediabetes. And we know that 1 in 10 Arizonans have diabetes. So this is a significant burden on our communities and our families. All of us know individuals who either have prediabetes or are living with diabetes. And we know that it contributes to large amounts of costs. So significant direct and indirect costs, estimated around $6.8 billion. But in addition to the costs, it has significant impacts on our members, on our loved ones. There's a number of adverse outcomes and comorbidities related to diabetes, including blindness, heart disease, loss of toes, feet, or legs, depression, and stroke. And so this is something that we definitely want to address and help Arizonans live their healthiest life. And so understanding the extreme impact that this has on our communities as a whole and our AZ Blue members specifically, we initiated what we call the Arizona Blue Diabetes Action Plan. So next slide. You can see that we took some steps, and these are the high-level steps that we took to develop this plan. And ultimately, what we're looking to do is reduce progression of diabetes among our members. So we started with a summit. We brought all the experts together in 2022, when we brought our public health partners and community partners to kick off planning efforts. From there, we set what we feel is an audacious goal. We identified supporting objectives and formed work groups that came up with ideas and action items that they would take in order to meet those objectives so we could reach our goal. And through the effort of those work groups, we built out this robust action plan and began implementing what we feel are meaningful actions. So next slide, please. And you can see that our audacious goal is to reduce the progression of diabetes by 25% by 2025. And the team identified that in order to reach that goal, we had to have certain objectives, such as reducing hemoglobin A1C levels, increasing the engagement of our members who are living with diabetes, increasing provider coordination and accessibility, reducing the disparity of outcomes among our members. We know that our rural areas have a higher risk of adverse experiences such as hospitalization and death, and then also monitoring our metrics to measure the improvements in our health outcomes for our members. So in 2022, we hosted listening sessions with our members and with our providers who are in our network to learn more about how we can better support them. And we're implementing strategies to address these findings. And these findings were things like I don't even know what benefits I have available or the benefits that my patients who I'm treating have available through their health plan. And so through the rest of this session, I'm going to highlight a couple of the strategies that we've implemented so far, and then some additional exciting things that are coming in the works. So next slide. So one of the things that we wanted to do, about 80% of those that have prediabetes don't even know that they're living with prediabetes and don't understand the risk of progressing to diabetes. So we wanted to make sure that we launched a public awareness campaign to share information about diabetes prevention and management. We launched a brand new website here at azblue.com/diabetes. We've got social media going, we've got blogs providing education and pointing to resources on our website so that we can educate our members and the community. So our website and social media accounts, if you're looking for a place to direct your patients or your loved ones to get additional information and links to resources, that azblue.com/diabetes is a great starting point for that. Next slide. In addition to building a broader online presence, what you'll see is we've enhanced our services out in the community. And like I said, that is one of the reasons that I came to AZ Blue, was their significant community presence. So we have nurses and dietitians and wellness specialists on staff who are out at these community events, at health fairs, and other sites throughout Arizona, providing education about diabetes. At many of these events, we offer free A1C screening so that members can know what their levels are, and then they can provide the members with education and with referrals based on those results. So recently we were at an event that was hosted by the Hispanic Chamber of Commerce, the Pinal Fall Festival in Casa Grande, a Diamondbacks game. We were out at Phoenix Pride supporting the Phoenix community and farmers markets throughout the state. And participants at these events will get linked to the diabetes risk test in both English and Spanish. And we also have nutrition education, including culturally tailored recipes and My Plate resources for our Hispanic and Native American communities, because their My Plate is going to represent their culture. So we also, though, partnered with the American Diabetes Association to do a number of things. But one of the things that we did, you'll see our bike riding team, we joined the 2023 Tour de Cure, and we sponsored the Wellness Village. So we were able to bring together multiple health partners to provide health screenings and education, and to link people with resources while supporting our local chapter of the American Diabetes Association here in Arizona. So next slide. And you can see that we also partnered with the American Diabetes Association to bring Project Power to Arizona. So this is a lifestyle program, and we brought both Project Power and Project Power Youth. And what they do is Project Power Youth is a healthy lifestyle program for kids that are 5 to 12 years old, and it's aimed at slowing the trajectory of childhood obesity. And so we were able to partner with the ADA and a few schools in our South Phoenix area to offer this program to several cohorts of students. And the nice thing about this program is not only does it teach the students, but it also teaches their families about healthy eating and getting engaged and getting physical activity. So we were very excited to be able to bring that and to provide them to some of our community schools. Project Power Adult is a brand new program that we sponsored to bring here to Arizona, and we made it available to all Arizonans. We made it's free. It supports adults who are diagnosed with prediabetes, type 2 diabetes, or at high risk for diabetes. And it provides 3 months of one-to-one coaching, small support groups, and resources and tools like activity trackers, scales, educational booklets, because this can be an overwhelming condition to have to manage. So our providers can, any provider actually can refer patients to this no-cost program by directing them to diabetes.org/Project Power. And it's open to adults, whether or not they're AZ Blue members. Anybody can sign up for this. So we were very excited at that partnership. So next slide. So we did hear that, our members wanted to know about their benefits. They wanted to understand what benefits were available, but then they also wanted education on how to help manage this condition. And so in addition to the public education campaigns and programs, we've done work to develop education to better support our members. So they have access to a diabetes workbook that's available in both English and Spanish. And this provides diabetes information, tools, and strategies so that they can take charge and manage their diabetes. And we're also working to build out member-friendly tools so that they better understand the benefits. Like, what kind of routine preventive visits do they have? What kind of coverage do they have for medications and supplies? And what kind of access do they have to specialty providers like dietitians, nutrition consults? And that's something that we really want to highlight, that nearly all AZ Blue members have access to at least 6 visits with a dietitian each year. If they have conditions like diabetes, hypertension, or obesity, many members weren't aware of this benefit. So we're working to raise the awareness, but we would love for our clinicians in the community to raise awareness with their patients of this resource as well. And we're also in the process of enhancing our condition management program. And beginning on January 1st here at AZ Blue, we will have a team of nurses and dietitians, many of them who will be certified diabetes care and education specialists, who will be able to work one-on-one with members who are newly diagnosed with diabetes and other chronic conditions so that they can build self-efficacy in managing their condition. This team will provide education and link members to additional AZ Blue or community resources based on their needs, including social determinants of health, and then we'll provide follow-up notes and information back to the member's primary care clinician so that we can ensure good care coordination and so that you know what we're doing with our members and your patients. So next slide. But our action plan teams are also very excited about a lot of the innovative programs that we've been able to develop and take off the ground so that we can understand which programs are going to best engage our members who are living with diabetes and support them in managing their condition and improving their health outcomes. So these are 3 that are various stages of implementation, but the first one that we're so excited about is the Food as Medicine program that we've implemented. Right now it's a pilot. We're currently partnering with a group called Season Health. And we've offered food as medicine to about 500 of our members who are living with type 2 diabetes. Through the program, they have access to Season Health's platform for 6 months, which includes virtual dietitian appointments, virtual education programs, and a curated food marketplace that includes medically tailored meals and groceries from local retailers like Fry's and Walmart and Sprouts. We are also, to those members, providing a monthly food subsidy so that they can be supported in ordering healthy food from the platform if they would like. We're monitoring outcomes like their hemoglobin A1C, their blood pressure, weight, and health-related quality of life. About half of our members who have enrolled have completed their 6-month program. And we're seeing meaningful improvements in the metrics that we're monitoring, including more than a 2-point drop in A1C members who started with an A1C over 8. So very, very impressive. The next program that we're working on is a medication management program. So we're running this through our pharmacy benefits manager for groups of members with type 2 diabetes. And it provides medication management, medication counseling, and personalized coaching from a diabetes specialist. So this pilot just recently launched. So we don't have the great data like we do from our Food as Medicine program. But once we get that, we will share. And then finally, we are going to be implementing a peer support program. So we're just getting ready to launch this for a small group of members with type 2 diabetes who have been recently discharged from a hospital. So we know that peer support is evidence-based, especially in our behavioral health community. But we've also seen great data about pairing peers with members who have conditions that they are living with and having to self-manage. So we will pair a member with a trained peer support specialist who has diabetes and can provide that one-on-one guidance and coaching about diabetes management. So all of these programs are pilot and they're not currently available to all AZ Blue members, but our hope is that after we get the great results and continue to get great results, like with our food as medicine, we'll be able to incorporate these into our benefits that we offer all of our members here in Arizona. So we're really excited to monitor the progress of these and have a wider rollout if they are effective in our members. So next slide. So these are just a few of the exciting things underway through our action plan, but we're continuing to look down the road at implementing other strategies. So in alignment with the recommendation of the state diabetes action plan, we're working on our coverage strategies. Components of these are covered through network benefits, like for diabetes prevention programs and diabetes self-management or education and support programs. And so we really, as we've heard from our focus groups with community providers and with our members, there are gaps and barriers that they face, either if they are a DPP or a self-management education program, getting billing or getting reimbursed for providing those services. So we're working on ways to streamline that. And then we're also increasing the amount of continuing education that we're supporting for our providers in network and are improving promotion of our continuing education opportunities. So the executive summary session of our monthly provider newsletters that goes out every month to our network providers highlights continuing education opportunities, including those like this that are available at no cost. But we're really excited. Martin Tull is our next presenter, and he's going to highlight some of the resources available through the American College of Lifestyle Medicine and the partnership that we have with them on provider education. So next slide. And with that, I am going to conclude my presentation and I am going to hand it over to Martin. So thank you very much.
Thank you, Dr. Christ. Martin, we will turn it over to you and get your slides queued up and look forward to your remarks. Thank you.
Thank you so much. Well, it's inspiring for me to hear a little bit more about what you all have underway as well. So thanks so much for that. Wonderful. Well, welcome everyone. My name is Martin Tull. I'm the Senior Deputy Director for ACLM. I'm really pleased to be here today. Next slide. Just wanted to make sure that you all knew just a little bit about the agenda. Want to run really quickly through some background about ACLM to give some context to some of the resources that we'll be providing throughout the state of Arizona, as well as nationally. Next slide. I have no disclosures or conflicts of interest to disclose. Next. So I won't touch on much of this, but a lot of our work is grounded in the reality of the impact of chronic disease and the disproportionate impact that those diseases have across our communities. This is really a core of why we're doing what we're doing, to be able to really reach and help people achieve health restoration. Next slide. As you all know, we certainly know that chronic disease is related to unhealthy lifestyle practices, especially poor nutrition, physical activity, substance use. And this will come up a little bit later as we talk about sort of the pillars of lifestyle medicine. Next slide. Basically, from NHANES data, found that only about 2.7% of individuals really had a healthy lifestyle. And so we've got a lot of work that we can do there. Next slide. The United States also has some of the highest rates of avoidable deaths. And next slide. Also some of the highest rates of healthcare spending. Next slide. And it really doesn't translate into healthy outcomes. We also have about 90% of our healthcare spend is for chronic and mental health conditions. Next slide. So I wanted to share a little bit about what we're trying to do about this and how this can play into our work here in Arizona. Next slide. ACLM as a nonprofit medical society is focused on sort of 6 key pillars as part of lifestyle medicine. We're looking at the importance of evidence-based strategies within the dimension of nutrition. So looking at whole food, plant predominant nutrition, regular physical activity, restorative sleep. How do we manage stress, the importance of social connection and reducing social isolation, and avoiding risky substances. Next slide. all of this work is grounded in clinical guidelines. A recent paper that I was involved with as well looked at dietary recommendations from around the world, looked at over 2,000 dietary recommendations from medical societies. And there's, of course, of overwhelming consensus of really what we need to eat and try to avoid to improve our health outcomes. Next slide. And lifestyle medicine and lifestyle change, therapeutic lifestyle change, is a foundation of nearly all of the clinical guidelines, regardless of condition. This is just one slide from the American Academy of Clinical Endocrinologists. And you see nutrition, physical activity, sleep, behavioral support, mental well-being, substance use. It's a foundation of clinical guidelines. Next slide. Again, here's a cardiovascular disease guideline, lifestyle change central to the guideline there. Next slide. Again, with hypertension, lifestyle change, lifestyle recommendations there at the beginning of the decision tree. Next slide. Same with diabetes care, as was discussed earlier. Next slide. The American Institute for Cancer Research also has many of the same sorts of recommendations as it relates to nutrition and diet. Next slide. Similar issues around cognitive decline, dementia, Alzheimer's. These are all of the same types of recommendations, regardless of many of these conditions. There's a shared commonality in the recommendation there. Next slide. And so part of the way that we think about lifestyle medicine and its role at a community level is really working to try to achieve the quintuple aim. We're looking at how do we advance health equity, how do we support the well-being of clinicians and care team members, how do we improve the care experience, how do we improve population health, and how do we also reduce costs. Next slide. One of the things that we found in working with our members over the years is that lifestyle medicine and the integration of lifestyle medicine practices dramatically improves clinician satisfaction. A recent study that we had done with members, we found that over 90% of the members who had included an integrated lifestyle medicine in their practice, it dramatically improved their professional satisfaction. So we're looking at how lifestyle medicine can also play a really key role in provider and clinician well-being. Next slide. We're looking broadly at how do we really reimagine some of the goals around healthcare? How do we really look at disease remission, health restoration, reducing unnecessary medications where possible, looking at patient satisfaction, looking at clinician satisfaction. These are some of the goals that we're focused on as an organization. Next slide. Next slide as well. So just to talk a little bit about who we are as context for the resources that I'll share. We're a nonprofit medical society focused on evidence-based lifestyle medicine strategies to treat, reverse, and prevent chronic disease. We believe that lifestyle medicine should be the foundation of all health and all healthcare. Next slide. As a medical society, we're composed of a variety of members. We work with all members of the important interdisciplinary care team, physicians, nurses, dietitians, medical techs, PT, OTs, and so forth. All are welcome to be a part of our community. Next slide. In the work that we do, we're focused primarily on professional education. This is a range and a spectrum of work that we do. We work upstream to try to improve the medical education for the next generation of healthcare professional, all the way up into formal certification in lifestyle medicine. Next slide. A lot of these programs are experiencing really tremendous growth over the last number of years. Just one example to cite, the Lifestyle Medicine Residency Program is a curriculum that could be adopted by residency programs. As of today, there are about 320 residency programs that have implemented the lifestyle medicine training nationwide. So there's several different education resources that we could look at for use in Arizona. Next slide. ACLM provides hundreds of hours of online and in-person CME and CE training. These are just a few examples there. The link there at the bottom, lifestylemedicine.org, is an easy way to get to all those resources. And we'll touch on just a few here. Next slide. Since 2017, the formal board certification was launched in the field of lifestyle medicine. Globally to date, over 5,000 professionals have become certified in lifestyle medicine. I believe that another 1,200 or so are sitting for the board exam this year. So that's certainly an opportunity to be able to obtain advanced training in lifestyle medicine if that's something of interest. Next slide. As was mentioned earlier, I'm actually here in Denver. I just stepped out of the conference for a moment to be with you all. We had about over 2,000 professionals here on site in Denver. And each year we host a large annual conference and bring folks together in person and virtually. That's certainly an opportunity to engage with next year. Next slide. Another piece of the work that we do is to engage with a very wide range of partner organizations. We do work with a large number of health plans across the country, accountable care organizations, hospital systems, academic partners. And most recently, we've begun working with a network of health systems to implement lifestyle medicine into clinical care. I'll have to look and find the Arizona facilities that are already involved, but would happy to talk to you about different ways that organizations can get more directly involved with ACLM. Next slide. We are very excited to be able to partner with Blue Cross Blue Shield of Arizona to offer our Lifestyle Medicine and Food as Medicine Essentials course. This course was developed about a year ago, and as part of a commitment with the White House and the Center for Disease Control, we offered 100,000 licenses for this foundational Introduction to Lifestyle Medicine, Food as Medicine training. And so there is a code for Blue Cross Blue Shield of Arizona that's being shared and distributed statewide. And you can also reach through the QR code to find out more about the course there. This is a completely free course and a great way to learn about the foundations of lifestyle medicine. Nationwide, we have about 33,000 people that have already taken part in the course. And so would love to be able to get you engaged in that as well. Next slide. Just a few different sort of engagement pathways for you to be aware of. We do have a large number of complementary resources. Dr. Christ shared some excellent resources earlier there. And so similar types of infographics, handouts on sleep and stress and physical activity. There's a number of those that might be of interest. We are a large membership community. You're welcome to plug in and get more engaged with ACLM or take part in any of the online education that we have as well. Next slide. And I wanted to include a link there for the website, lifestylemedicine.org. You can also email us directly for follow-up. And then I wanted to make sure I left some good time for discussion with the group and with Dr. Christ as well. So Jessica, with that, I'll turn it back over to you.
That's wonderful. Thank you so much, Martin, for all of those resources and that background. That's excellent. As a reminder to our participants on the call, we will share out after this meeting is over a link where you can review this and share some slides too in the coming days as well. So you can revisit any of those resources as you want. There is the Q&A function that you have, and so please make sure that you are putting any questions you have in the Q&A, and we'll work to address those with the time that we have remaining in this session. As a reminder, at the end of the session, we will also be putting out the QR code where you can go to find out more about your CEUs and talk about next month's session. So anyway, I'd like to start with a couple of questions, and we'll look for participant questions in the chat as well. And I'm going to start high level on lifestyle medicine, and then I've got some diabetes related questions as well. But first, Dr. Chris, Martin left off there talking about the Essentials of Lifestyle Medicine course. And you are, Dr. Christ, one of the 33,000 people who've taken that course. I'm just wondering if you would be willing to share briefly with the participants your experience with that course.
Yes, let me come off of mute. I will say I highly recommend taking that. It was a fantastic CME course. It 5.5 hours went very quickly, and there were tips that you could provide to your patients. It was easy to understand. What I really, really liked about it was they went through on one of the modules, they went through all of the different diets that you hear about now that people are working on, your patients may be experiencing. They talk about the evidence base behind those diets and give the pros and the cons and what the evidence is showing as they're talking and comparing all of the different diets. I thought that was really, really interesting. But then I really appreciated the very small take, like it was guidance, and it was in small bite-sized chunks. So like you could give your patients very specific steps that they could take, and it wasn't an overwhelming lifestyle change, but were actions that they could take to empower themselves to, get more exercise, to eat healthy. I was highly impressed, and I'm looking forward to doing more of the continuing education credits that they have. And based on that, I actually signed up to be a member. So Martin, I don't know if you had anything else, but I've really enjoyed the content that's come out.
Well, I appreciate that. That's really wonderful to hear. And we have had really positive response from that. And I think that one of the things that you might be able to speak to as well is that a lot of this type of information wasn't part of your formal training. And so, we find that, most clinicians have, maybe 10 hours total of content around a lot of these important aspects that relate directly to the chronic diseases that you're dealing with. So we do find that there's a really important role for us to play in continuing education, since a lot of this, was much of this covered in your medical school training?
No, not to that extent. I mean, that you always get the eat healthy, eat your fruits and vegetables, get plenty of sleep. I mean, but these were actionable steps on how to counsel your patients to do just what we were telling them. And so I thought it went into much more detail. And the 5.5 hours was a pretty high level. You can definitely dive in more. But even I would feel more comfortable about providing someone education on how to make these lifestyle changes that would, promote wellness in their own lives. And so I thought that was excellent.
Fantastic. Jessica, what are some of the other topics that came up in the Q&A?
Yeah, so Martin, you talked about how lifestyle medicine can address the quintuple aim, including health equity. And I'm sure we could do a whole session on that topic, but I'm just wondering if you could go a teeny bit deeper in that and just briefly comment on some best practices to support implementation of lifestyle medicine across different cultures or languages, beliefs, et cetera.
Sure, I'll share. You're right. It's definitely a 2-hour conversation. We were actually just having our closing panel was on health equity and lifestyle medicine for the conference. A few thoughts. It's a really important issue for ACLM as a society. Health equity achieved through lifestyle medicine is one of our largest focus areas for our members. There are over 800 members that are involved in that initiative. It's a national priority for us. We're working with networks of federally qualified health centers and community health centers around the country that are implementing lifestyle medicine into clinical care. We're also looking at research in the health equity space as well. There's such an important variable. These determinants do play such a large role in the development of these chronic diseases. So it's absolutely important.
You. I've got a diabetes question for both of you too. Dr. Christ, we can start with you. And this is a broader, like big picture question, I guess, but we know that there's increasing rates of diabetes. What are some of the biggest challenges that you see in diabetes prevention and management in the next 5 years, 10 years? I don't know if you can see that far ahead, but.
I would say one of the biggest challenges is just the continued increase in the number of people who are being diagnosed with diabetes and pre-diabetes. And it's getting into our younger population. So we're seeing more of it in youth. I think, as we get more people who have prediabetes and may not be aware that they have prediabetes, it's really important to get the awareness out, because there are steps that they can take to either slow the progression or reverse it. Which is amazing. Again, you'll learn about that if you take the CME course. But there's also exciting scientific advances that are coming in, like new developments in our GLP-1s. It's very, very exciting. Right now, the cost structure is currently unsustainable. And we don't have good data on the long-term impact or like how you get people off of these therapies, but they are showing really great results, not only for obesity and diabetes, but they're starting to show other results we're seeing in heart conditions as well as dementia. So that's a very exciting field. The other thing that I'm really hoping that in the next 5 to 10 years, that some of the emerging data technologies will allow the healthcare system, both payers and providers, to work in partnership to provide better, like personalized and tailored support for people. Because in order to have people make some of those changes, they're going to need a lot of support, but the changes that I may need aren't going to be the same as like the changes that Jessica may need. And so really, how do we support each other if you know that your patient has a social determinant of health and we have a social determinant of health ability to link them to that? How can we work together to get that data shared?
I'll just add a few thoughts about how, some of the ways that we're working on this issue. We launched a course a few years ago on reversing remission of diabetes and insulin resistance. That's an 18-hour CME training, really looking at tools and techniques for engaging patients in that sort of customized journey, Dr. Christ, that you mentioned. So certainly there are opportunities for advanced training and education that just relate to diabetes. There's other tools for engaging patients like motivational interviewing and others that help to really understand some of the factors that lead to the condition in people's lives and some of the reasons that might motivate them for change. What is the meaning and purpose that might cause someone to really want to make changes in their life? Personally, I feel like there's a lot of conditions that are perceived as something that just runs in the family, when really a lot of these things are actually greatly affected by the choices that we make on a daily basis. So if we're able to create more agency for individuals to be able to find their why and get the tools and resources from a program or from their clinician to kind of get them on the right path.
Thank you both. And we've got another question here requesting that you speak to the role of integrating behavioral health screening and supports into diabetes management. Can you talk a little bit about your thoughts around that integration between behavioral health and diabetes, and any resources or anything else you want to highlight around that topic?
Sure. Do you want me to? I can start.
Yes, go ahead, Dr. Christ. Thank you.
Okay. One of the things that we're working on here is really focusing on whole person health, because we've always said you can't have good physical health without good mental health. And if you have poor mental health, it's going to impact your physical health. And so what we've been trying to do is to implement programs that are going to support that whole person. Our care management team here at AZ Blue works with members to assess their whole health and support meeting them where the member is at. So sometimes that means even if they were referred to us for diabetes, but they have a significant need to get mental health resources because of depression, they will link that and provide that. They don't just work on the diabetes because that's what was referred to us. And so really making sure that we're supporting the needs, all of the needs of that member. The CDC and the American Diabetes Association also have some great resources for patients about the intersection of diabetes and behavioral health. Getting a chronic disease diagnosis can be devastating to some people, and whether, the diagnosis is causing the depression, or they just don't feel good and they've got depression, or they've got depression and they have stress and have developed a a chronic disease, we know that there are intersections. So having those resources available to be able to address both with your patients is also always helpful. And the American Diabetes Association has resources for providers, including free continuing education courses on behavioral health and diabetes care. That's one of the things we're also hoping to be able to touch on with our peer support pilot, is not only will they be able to help guide with the treatment, but they can also act as a peer support for behavioral health needs if they need to as well. But there's a whole mental health provider directory listing, and they list mental health providers with expertise in treating patients with diabetes on the diabetes website. So if you have a member that is experiencing concerns or just needs help with mental health, you can always link them to a resource there. And you can always find providers for our members who are in network on our website at easyblue.com.
Thank you for that answer, Dr. Christ. Martin, what else would you add related to that integration of
Sure.
behavioral health and
I
diabetes?
think just one quick anecdote. I think that one of the reasons that the pillars of lifestyle medicine are sort of seen as a circle and a pie and an interconnected collection of issues, is that we know that if we're isolated, if we're lonely, if we have issues of depression, it's very hard to make good food choices. If we're not physically active, it can lead to increased stress and so forth. So these issues are quite connected. It's one of the reasons that we feel it's really important to address, as Dr. Chris said, the whole person in the care that we're delivering. We're not just looking at physical activity by itself, or just looking at nutrition as it relates to diabetes. We're really trying to understand all of those conditions that can lead to health restoration.
Thank you. We have a question in the chat regarding food deserts and the role that food deserts might play in rates of diabetes. Thoughts on that?
Yeah, absolutely. So we know that we have food scarcity areas here in Arizona and their nation and worldwide. Not having access to those fresh fruits and vegetables and to healthy foods can play a huge role, because if you don't have access, you're left with lots of fast food, lots of unhealthy choices. And just like Martin said, when you're stressed or you don't feel good or you're depressed or you just don't have time, right, to be able to go outside of your immediate surroundings to go get healthy food, the community you live in plays a huge role in your health. And so, teaching, it's important, one, to get access to the fruits and vegetables in those areas. And I know that when I was at the Arizona Department of Health Services, we were putting lots of strategies in place in Arizona in order to reduce those food deserts, because the unhealthy eating, if you're eating a lot of things that can raise your blood glucose, which will elevate your hemoglobin A1C, that can cause the insulin resistance, and then you can develop diabetes. Part of a healthy diet, that's one of the things that we want to have our members and our patients maintain. Not having access to that healthy fruits and vegetables is just going to increase the higher consumption of those unhealthy foods. And so doing things like getting the fresh fruits and vegetables, I know that there's Fresh Express, there's lots of different things that are going on in the communities, but also teaching your patients, which I thought was one of the interesting things, about making the good choices. So if fast food is all they have, what are the healthiest choices that you can make, so that instead of getting what my little kids like, which is the chicken nuggets and the French fries and the milkshake, maybe it's the grilled chicken with a side of salad, like the grilled chicken sandwich and the side of the salad. And maybe you don't eat the bun and you get water or unflavored iced tea to drink with it. So teaching them how all of those choices can add up and improve health.
I think it's very well said. I would only add that, I think that access to healthy and nutritious food is certainly a huge barrier. Knowledge about what food is nutritious is another barrier. And then skills and time are other barriers. So I think as we need to focus on all of those, access, Fresh fruits and vegetables are important, and frozen fruits and vegetables are also quite healthy. So, there's both, access and knowledge and skills, and it really does require a lot of intervention to help people make those better choices.
Yeah, Martin, I couldn't agree with you more. It was so funny because after, we've been implementing a food as medicine, and after taking the CMEs and stuff, it made me think I need to change the way that I'm eating a little bit. And even, having gone through medical school and being part of the healthcare community, there were times I was like, I don't know how to cook this. How do I make this, or where do I go get that? And so I think you're right. Providing the information about the healthy foods, what's healthy, what's not, how to eat it, even like what a serving is really, really important.
That's right. And even with those constraints, there are some choices that we can make. I mean, Walmart has a lot of very delicious, inexpensive frozen meals, frozen fruits and vegetables. So these choices are out there. You just have to know a little bit more where to look sometimes.
I think that segues perfectly into the next question I was going to pose to both of you, Martin. So thanks for teeing that one up. One of the biggest barriers we hear for patients in managing their diabetes is related to cost. And so people start hearing about, eating more fruits and vegetables and thinking that's really expensive, or some of those other pillars of lifestyle medicine. Maybe they've got thoughts of cost associated with those. So I'm wondering, Martin, if you might be able to comment from an ACLM perspective on, what you hear about cost and that being a barrier, and kind of responses to that or resources. And Dr. Christ, just from the payer perspective, anything you want to talk about related to cost reduction or cost savings? Martin, I'll turn it to you first.
Sure. I mean, I'll start with saying that it's very understandable that perception that things are just more expensive, healthier is more expensive. And part of that is because sometimes we talk only about fresh fruits and vegetables. I was at Walmart recently and noticed that microwavable brown rice is less than $1. Canned beans are less than $1. Sweet potatoes are very inexpensive. Many of the healthiest foods are actually quite inexpensive, but you need to know what those are, and you need to be able to, look for those. I mean, canned foods is another great example. Canned rice and beans and soups and things often can be quite healthy and nutritious and easy to sort of stock up and keep in the pantry. ACLM has created a number of resources around this. We have a plant-based on a budget toolkit that's a downloadable resource that folks can have. There's also some other infographics on, how to create, simple, nutritious bowls that you can put together with resources. So I think it's another one of those things where there's access, there's knowledge, there's skills, but when you put a few of those things together, you certainly can eat healthy foods on a budget.
And from a health payer perspective, we do hear about the cost, and it's costs that are associated with medication. It's costs that are associated with copays to see providers or specialists. And so there's a number of things that we're doing in order to make things more affordable for our members who are living with diabetes. For members that have our pharmacy benefit, and so some of our plans, they opt out and they choose a different pharmacy benefit, but those that are on our pharmacy benefit, we have multiple strategies in place to reduce the cost of many of the diabetes medications. So we have a partnership with Sempre Health, and that is an organization that provides copay discounts for members who fill medications on time. So it's a medication adherence program, and currently 14 diabetes medications, including insulin, are included in this program. So if you've got a AZ Blue member and you're interested in learning more, you can certainly go to our website. Another pharmacy example that we've got is starting January 1st, our pharmacy benefits manager has a program called Price Edge, and we will have that in place for our members. And it'll automatically scan all the discount card pricing like GoodRx for generic prescriptions. And it's going to automatically apply the lowest cost for the medication. So that's a program that we're very, very excited about. A handful of our Affordable Care Act plans also cover certain insulins with either a $0 or a $3 copay. And you can find on our website where you can identify like what tier the medication is, if it's eligible on our plan. And then we're always looking for other ways to support. So like evaluating additional options for reducing member cost share, exploring innovative programs, like we said, like the food is medicine, and offering that food subsidy so that they can purchase the nutritious foods that they need, and then offering things like Project Power programs, so that additional resources that members have so that they can manage their conditions that they are living with.
Thank you so much. We're almost out of time, so I'm going to close on one question. There's been a lot of conversation about food, and we know how important food is, not just for prevention or management of diabetes, but other chronic conditions as well, as you've highlighted, Martin, through your talk too. So just to close out briefly on food, any ideas from either one of you related to other strategies to make healthy foods more accessible, or to help people gain the resources that they need to identify healthy recipes that really fit in that stretched family time that so many people are going through? How can they get accessible, healthy foods that they can make quickly in order to take advantage of those opportunities? So we'll let you leave us all with some resources, and then I'll make some closing remarks.
Did you want to start, Martin? It sounds like you guys have some fantastic resources.
Sure. I mean, it's funny. I feel like I'm going to say a similar thing again, but many nutritious foods are actually very inexpensive. Potatoes, onions, beans, rice. Many of those foundations of a healthy diet are some of the least expensive foods in any grocery store, Walmart, frozen, fresh. So I think part of it is really just starting with what is the foundation of your plate? And how do you get a lot of healthy fiber, a lot of healthy whole grains, a lot of vegetable content there as the core of what you eat? And if that's 70 to 80% of your plate, and you start with that, you'll get full, you'll eat a fairly nutritious meal. Similarly, you can add an apple. You can eat an apple before meals as another way of kind of preloading some healthy calories, in there. So I think there's actually quite a few strategies. It really takes a little motivation. Once you're motivated to sort of like think about those things, then I think you can find a lot of resources there. But we've got to find a way to sort of build the motivation, build the interest first. And then there's plenty of toolkits and recipes and resources. But Dr. Christ, I'm just curious how you feel about that.
I agree with what you said. I think that there are plenty of options, fresh, frozen beans. I think finding the recipes, you can find lots of different recipes for healthy, quick meals online on the American Diabetes Association. The state of Arizona does have, and I'm blanking on the name right now, but it used to be the AZ Nutrition Zone. It may be AZ Health Zone, but they've got a large number of healthy eating recipes that don't require a lot of ingredients, but they're all healthy and low cost. And so looking online, you can find a lot of different recipes and opportunities to use the fruits and vegetables or beans or whatever you have at home in order to make those healthy recipes.
Well, thank you both so much. My stomach is growling. One of my strategies for quick meals is to meal prep on Sundays. So that's another one to throw out there, is just make your healthy food ahead of time. But I want to thank you, Dr. Christ and Martin, for joining us today and for sharing your expertise. I think we all gained a lot from that. And to all of our participants today, please stay tuned for an email with a link to a survey to redeem your CEUs for this event, as well as resources that were shared during this session. Oh, you can see this QR code to complete the survey actually right now if you want to get your CEUs. And please save the date for our next Arizona Community Grand Rounds. That'll be on Wednesday, December 6th from 12 to 1. We're really excited to welcome statewide experts from TGen, the Translational Genomics Institute, and the Arizona Department of Health Services to discuss emerging infectious diseases. So that should be a really interesting topic next month. We hope you all join us then. Please enjoy the rest of your week and take some time to learn more about diabetes during this Diabetes Awareness Month. Thanks, everyone. Have a great day.